The meeting of January 12th, 2004 is now called to order. There is a quorum. First matter of business would be approval of the minutes. Anybody want to take a minute or two to read the minutes if they haven't so far? And then let me know if there's any questions or changes you would like to see things amended on.
I make a motion to approve the minutes.
I second the motion.
Okay, all those in favor?
Do we have to do a roll call if there are people?
I think that because there are voting members,
There's a quorum here.
there's a
Yeah.
form here, so I don't know.
You gotta
Jim?
do a roll call vote, Jane, when there's hybrid members.
Okay, all right,
Okay,
so let's start with the hybrid members. Jim,
Yes,
Tom,
Yes.
and then Terry's here, and then we're super happy that Terry, you're here, but also Brandy's here, so I don't know who's voting for.
I'll vote for voting.
Okay, Brandy, Jane, yes?
Pat, yes.
Diane, yes.
Brandy,
yes.
Jordan, yes.
I can't vote because I wasn't here.
Okay, Rebecca,
Rebecca.
yes.
Okay. So moved and passed. Public health update. Jill is not here. She's on vacation. Does anybody want to step in for her to say anything? Right ahead, Jim.
Yes, so we've actually had, the end of the year was, so this goes up through December. And it really covers, kind of the tail end of our COVID clinics, which I believe, I'm not, the last time we met, we'd already had the clinic. And the one thing that I wanted to point out in the quarterly report is you will see some, TV on there. That's actually
Mhm.
latent TV.
Mhm.
It's not active.
Thank you. I was
And-
gonna ask about that.
And so next time we are going to list latent TB cases and then have another line for active TB cases. There's no known active TB cases in here. It actually is a result of screening, right? So it's one of those things, just like COVID testing, the more that people get tested, the more the numbers go up. And so I just wanted to point that out to everyone.
Jane, a question on the TB, is that the CHP program doing the pre-employment screening for the families that have come to Berkshire County? Is that what we're kind of seeing with the TB?
I'm not entirely. So it is, most of these cases did come from CHP, yes.
Okay.
And then, so a couple things that if Jill were here, she would want me to say. One is that, we did commence doing the, blood pressure clinics after, so we had clinic season, we had medical leave, and so we have started doing those again. We'll talk about it later, but we have, been interviewing for our community health worker position. And so that's a really exciting way for us to think about what other types of things we could be doing in the senior centers or for the community. And Jill also is working with a nurse, I don't know her name, to also do some community wellness at those, I guess, yeah, the sessions. And I think the reason, I think Jill got away from using clinics because there's, like everything, there's definitions for different things, so she's calling them wellness sessions.
Oh, okay.
The car seat program, we continue to get requests for car seats. We are out of car seats. Jill did apply for a grant and get an initial, I think like 55 car
Yeah.
seats or something. Last year we had 100. The need in the community is tremendous for families both to have car seats. People are getting priced out of life, and so, and then also there's a tremendous need also for proper use of car seats. So, that's something we're gonna kind of talk about later. Yes, Pat.
It turns out that the social worker in Pittsfield is also doing car seats. And they have a stack of them, I think some 40 at this point. So but they're targeted appropriately at low-income people.
Mhm.
But if there are people that we can refer, that Jill can refer up there and connect with, what's her name? Aria's first name, I can't
Maria.
remember.
Gabriella,
Pardon?
maybe?
No,
It's from the health department?
from the health department.
Yes, and
Yeah.
so we have been letting people know that that's available. And in fact, if you were to email Jill right now, I believe it would say, if you have questions about car seats, contact the Pittsfield Health Department.
Ah, great, okay.
So we are working hand in hand. We were the first group to kind of get restarted. Jill got certified, and since then Pittsfield, we have some Alliance individuals, and then also a couple of the police departments have started doing it. So it is good. It's a good service, and I'm really proud that we're part of that.
Yeah, and if I could just, oh, sorry, go ahead.
Applying for the grant?
She reapplies every year. She didn't get the Toyota, whatever for life, grant this year, so, so she'll apply to both of them next year. I suspect that there's some community benefit funding somewhere that we could tap into for this year to cover the gap. And so that's one of the things that we're kind of, so if anyone has any ideas, please let me know. And the other thing is that, is that something that we as a collaborative would like to, invest in having some car seats, to fill that gap? So.
Couple thoughts and ideas, Jane. I know we discussed this internally. So one of the reasons why we didn't get the grant this round is because we got the grant the last couple rounds and we were the only ones doing it. So as newer programs like Pittsfield and others start up, they're going to get the priority over the first round of the grants. And so a couple thoughts that I had regarding her, there's a need, significant need. We're getting calls every day on it. So a couple thoughts, we are working with PHE staff, and Mike, we had a long talk with our contract manager yesterday about the amended budget and the amount of money we got to spend in a certain period of time, which creates challenges. It's unclear if we can use PHE funding with respect to the car seats, because the majority of PHE is workforce, performance standards, and so on and so forth. There's very little dollars for equity kind of work. However, as we start to get our vaccine reimbursements in, which trickle in, and we spent a lot of money this year, as this board recalls, on private purchase of flu, COVID, et cetera. Once we get an understanding of what that vaccine revenue is, when we add that up and we figure out the annual Board of Health contracts, there may be some flexibility there to use some of those dollars to purchase car seats. A third thought I had, when Jill gets back, we're going to sort of put together like a white paper on how many car seats we distributed by sector of community, by demographic. And I would like to solicit Walmart and some other partners to see if there's an opportunity to partner with some of these stores that are willing to maybe donate car seats, and it's a community benefit that they can hang their hats on, and it fills a gap in need. So once Jill gets back, we're going to kind of work on that. Included, we may solicit Berkshire Health Systems and see if there's a community benefit option. So I always like to explore other funding before we tap into funding that's really dedicated for other purposes. But I'm really open to ideas and suggestions. Car seats are expensive. They're quite expensive. But when we see a family pull up to the department and there's a 1-year-old sitting in the front seat, barely on a seatbelt, that's a problem in our community. And we're seeing a lot of this in South County.
Can I, Jim, have you spoken at all, or have you given any thought to speaking directly to the manufacturers, telling them that you're not in a grant program this year, and seeing whether or not you can forge a partnership there? We did that with insect shields, the people that tick-proof clothing for you. We have a special deal for PHE people down on the islands. And all I did was call the president of Insect Shield and, say, we need your help. We're giving these out to migrant workers that come out to the island to work, and there's a tick presence and a real issue. And the guy knocked the price way down and sent us all sorts of promotional stuff that that we'll put out on our tables for them at ag fairs and things like that, in exchange for a huge discount and a certain amount of free stuff for the staff.
It's on the table. We'll add that to our ideas on how we solicit. I always find there's a fine line as a municipal government, what we can and can't do with respect to solicitations. But that's why I thought of Walmart's. It's not in my town. I don't permit them.
Well, that's a good point. But we did that also back in the day when we couldn't get vaccines onto the islands. And the guy that owns Cape Air, a guy named Dan Wolf, who his name might be familiar because he ran for governor a couple of times ago. And I called Dan and told him that we literally can't get the supply onto the island. And he gave us he has one freighter plane, and he gave us a freighter plane for a day and said, any way you need to send this, just tell me where to go to pick it up and I'll get it onto the islands for you.
That's
and
awesome.
That for free. So, I mean, you have to think about the community partnerships that you guys can be working on through the PHE program, because there's a lot of do-gooders out there that would love to help out.
There's also grants. I mean, Walmart has a grant program. I'm sure like Home Depot does, even Price Chopper that it's not a lot of money, but you could apply it to buying seeds.
And I think one of the key things that's happened in the last quarter is that having Jason come on board has freed my position up, and then we're getting the community health worker. So I think we're gonna find a lot more capacity to do stuff like that. As now that we're kind of firing on all cylinders and really looking at that equity piece, and also like having physical time to do the work, which is great. Yeah. The other thing is that like with the new arrivals, that came through the immigrants that came, to South County, one of the things is that technically they should be getting a car seat, but it takes like 2 months to get it. And so we covered that, like that gap. And so that's something that, was just one of the things. And then the other thing that we've learned is that, like Haitian Creole isn't really a written language. And so figuring out how to get the information to individuals that might not be used to using a car seat, or really understanding fully what
The requirements are in this country,
what the requirements are, and then also just like, ultimately what they're for.
Yeah, the safety reason for it. This is why you use it.
Not just a place to put your child, but
This is a safety.
there's a safety piece. So trying to figure out how to get that information in appropriate language and an appropriate level, introductory level to meet where they're at. Because it's a lot of information for anyone, and especially if you have language barriers or you've never really used a car seat.
But doesn't your language translation interpretation service cover that language?
So we actually had someone come out physically, to help, the individuals in Great Barrington, fill out their work papers. So we were with Mouse Hire, Fairview, and us were there to help them fill out their work papers. And then we took that opportunity to have Jill work with the live translator to do 2 car seat programs. One went pretty well, and then the other, it was cold, and it's especially cold for people from like south of here. It was cold to have the baby out in a car, and so it didn't go so great. And so that's where we were like, okay, this isn't working for that individual. What do we need to do? So, yeah, we're just trying to like adjust.
Jim mentioned at our meeting on Wednesday, Lennox board met Wednesday, about the translation program. And maybe the possibility of doing sheets, just paper sheets that are written in a particular language that you can hand out for
Except
them.
you said it wasn't really a written language.
Well, but they know, a lot of them know Spanish.
Yeah,
Okay.
So the question, and I think that the National Guard's working on this, like figuring out what the people speak and what people can read.
okay.
So a lot of the individuals know Spanish, many of them know French
French.
and read in French. So if that's the case, then maybe we should get it in French.
Yeah, just to have, I mean, and a lot of times, I mean, in my line of work, sometimes you would talk to people, but I don't know how much they would really retain in a new situation that's
Right.
foreign to them, to have a backup of a sheet of paper to go home to, even if there's someone in their community that knows the language, that they may go to the neighbor and say, what does it say? Might be of help.
Yeah, I have a native French speaker that you could use if you need to write stuff.
It might be interesting to try that and see how that goes.
Mm.
We do have the ITI contract.
Mhm.
It is fully paid for by public health, the PHE grant. It's an allowable expense. And one of the things that's on the agenda is to find out who from each community would like to have a pen. And I'd like to, this month, get those names and pins in, so that every single town has access to translation services, but I need a name to attach to, that PIN number. So, yeah, that's kind of where, but these are all great suggestions and,
Can I ask you one more thing? When you said you forwarded, or when people came and you they haven't gotten their car seats because it's a 2-month wait. Will you get those car seats? So like, no, you played it forward with ours, but we won't be able to stock ours from the backlog of them waiting for their own. So,
I don't know how that would work
okay.
and
Just
sometimes
asking.
like with different programs and different state programs, it's very, like the conversations around it are very difficult because you don't know who to talk to.
Okay.
And, but
There's
that's
no
a
way to
great
recoup
question.
it, no way to recoup it.
Unknown.
Okay.
But, unknown. Jill actually was talking about that the other day, so if Jill were here, she would have the answer.
Yeah,
Okay.
if I can just expand, Jane, about the PIN, and I think we've discussed this before, so we have a contract, which is under the state contract for interpreter services. Now, they charge by the document for translation of like materials, and we pay by the hour when they come out. So it's not super expensive, but like for example, we got a Thai family that walked into Tri-Town one day during the holidays, mother and 2 children, couldn't speak any English, trying to get them, access to the food pantry example. So we struggled with that. That was before our contract was in hand. So now Zach and other people in our department have full access to interpreters and translators. They call the number, they issue a PIN, and in real time they get service. Same thing, like Rebecca, someone walks into your office that you're having a hard time understanding, or you do a housing inspection, for example, or you do a food inspection, or you got to take enforcement action on a restaurant that doesn't understand English. The agents will have access to interpreter and translators to assist whatever we're working on. So Jane just needs a roster of who those points of contact will be to give you a PIN number.
Okay. Moving on, anything else for the quarterly report that Jill would like to
I have some
talk
questions.
to us? Okay.
I guess this is mostly related to the first quarterly, from July to September, but I was just wondering if
Can you
contact,
speak up?
if contact tracing illuminated where, campylobacteriosis came from and the cyclosporiasis
It's great.
and Vibrio, were those food related or water related?
The Vibrio, was, I believe, water related. I don't know because, Jill's been following up on those. I will say so I'm covering for Jill this week. It's my first time ever doing that. And in one of the towns, it was somebody came with, urinosis, which is usually pork borne, right? And so when that comes in, first you have to determine like how long they've had the symptoms and see if you can figure out where they were eating. And then if, like, let's say they're like, I ate at GB Eats and then 2 days later I got sick, then then Jill would call you guys and say, could you check out GB Eats and notify you? With this one that just came in, the person had it for like the symptoms of diarrhea, really a lot of discomfort for like 3 months. And was finally getting treated. And wasn't a food handler, and had no idea where it came from. In that case, we wouldn't reach out to the Board of Health. And so, if it's foodborne, then I believe if it's foodborne and it's associated with a potential restaurant, then we would reach out to the Board of Health. And that, right now, that's kind of what the flow is,
Okay,
yeah.
well, we do have a few public pools in Great Barrington, so if contact tracing narrowed it down to, say, Berkshire South or Simon's Rock, could Jill also call the Board of Health so we could follow up with those public pools that are in our jurisdiction too?
Absolutely, and I'll talk to her about that, if any of the waterborne stuff, so like, you have pools, Tri-Town has pools, I don't know if anyone else has pools, but if those happen, waterborne, I'm not sure what her process would be, but that's a great idea.
Okay, and Ruby's here too on Zoom, so I'm sure Ruby would be curious, but I'll just follow up with an email too to maybe get some more information. Okay.
That's it.
And I don't know why I put the quarter one, I couldn't remember if, oh, that's right, at the last meeting, the quarter one wasn't done yet. And so I included it so that you guys had a hard copy, and also now you have a digital copy as well for that. And it was kind of interesting on quarter one. It does have the clinic summary of, the different types of vaccines, and, this is actually, carried out not by where the clinic was, but where the address was. So as we talked about at the Mount Washington meeting, you know, Mount Washington's underrepresented. You know, places like, New Marlboro are underrepresented, Alford are underrepresented because, it depends on what they put in when they registered, if they put in that they were from Alford, or if they put in that they were Great Barrington. That's just a kind of a fun little thing, and then we have our updated work plan with the objectives that that we're responsible for working on this year are also on that quarterly report, which are kind of good for us all to remain aware of.
Okay, thank you. Old business, do you want to talk about that equity access coordinator position? Had a few bites?
Yes, we actually had some really good applications. Wouldn't you say, Jim? Like, we're very pleased with the.
I'm amazed. I couldn't get any applications for a full-time inspector with benefits, but I got about 30 community health worker part-time applications. Go figure. A lot of them are from the UMass Public Health Program. We feel, so the next 2 weeks, Jay and I are gonna kind of go through like a preliminary Zoom screening initial interview to kind of see like the top candidates, and then circle back and do a in-person interview with the top couple. We feel really confident. We started that process yesterday. It took a little bit to kind of get things going. And, you know, I voiced my frustration with DPH Mike yesterday that here we are in January, just getting a contract amendment package signed, which is pretty ridiculous. So we're sort of on a standstill to figure out that funding piece, but we feel really good. You know, we budgeted part-time for the position, 19 hours, that's not benefited, but we feel pretty confident if we get the right person in, kind of hit the ground running and kind of get acclimated. We really feel this is a full-time position, and there's room to grow in this position. And so we're going to try to focus on part-time to kind of get that position up and running. But this is a major piece of the puzzle. You know, now we have Jane in place, Jill in place, Jason's in place. Get a community health worker that could be boots on the ground, even deeper in the community than we currently are. I'm really excited about this adventure. So,
Do you have any idea when you're hoping to have it done by? March?
ideally, I would like to have this person start by second week of February. So we're gonna
Nice.
go through this week and next week, then
Okay.
immediately go into the following week. And hopefully 2 or 3 weeks later, kind of have this thing in place.
Or something.
Mike might want to speak.
Oh,
Yeah, I'll just say that the frustration, Jim, that you're feeling about the amendments is there's not one of the 51 groups that's any further ahead than you are, and it's disgusting. And we have let it be known all the way up to the commissioner level that it's intolerable, because there are groups that want to make hires that can't. And we're going to get so much money dumped on us in
Mm.
February and March. You know, you're going to get whatever that supplemental budget is for, each group is different, but you're going to get your money like February at the earliest at this point. And I had suggested to Sam that that OLRH might want to, instead of hiring a yet another deputy assistant friend of, or whatever, however low on the org chart the next person is, they should be looking maybe for somebody who has an MBA instead of an MPH to help them on their level. And he explained to me that that's just not allowed under state government. So we're working at the speed of state government right now, which is just intolerable.
Yeah, and I don't want to go on a diatribe and hijack the meeting, but Jane and I did meet with Ileana, and for someone that's worked on budgets my whole career, the conundrum that all these programs are going to be faced with is they're going to be dumped with all sorts of money, and
Right.
more likely than not, it's going to have to be sent back by June 30th unless they allow some type of rollover. And just banging out and buying $30,000 of COVID vaccines is not the answer, because our COVID vaccine numbers are low. CHP had to get rid of a bunch of vaccines because they couldn't get people vaccinated. And we've already done the largest chunk of vaccinations already. And so you get $40,000, which is wasteful spending of COVID vaccines that may be thrown out.
It's ridiculous. It's
Now, if you would have told us in September, that's a different
when we were
situation.
paying for it.
no,
Yeah,
well,
and they
the-
just came out an amendment that allowed people to, like, programs to use it for flu, COVID, and
RSV.
RSV,
no, not RSV,
shingles.
shingles, I believe. And the response was like, that's great, that's what we were begging for in September. And so I think, Donna Witchman from, BHS called me, Fairview called me the other day to see if there was a need, and basically our need right now would be just having some vaccines on hand for potential homebound individuals. And the suggestion was made is maybe, because CHP had a bunch that expired, like maybe we could reach out to the Alliance, because they're, I believe, out of COVID, and see if we could do like one minimum order, which is 100, that was like region wide, to see if maybe with a new batch that's not gonna expire. Yeah.
Okay.
Sorry, I didn't mean to cut you off, Mike.
No, it's fine. I just want to let you know that what's going on there is not unique to your group, and it's disgusting. And I'm wondering, Jim, did they bounce your budget back at you a couple of times to have you revise this, that, and the other thing? Is that what? Because that's what happened to a lot, including me.
And I don't want to hijack this meeting.
It's frozen.
Yeah.
The question is, did they bounce a bunch?
Anyway, go ahead, because there's much better
Okay.
stuff to talk about.
All right. On the language support. Oh, no, go ahead, Ruby, sorry.
Completely after Christmas, and I now the budget's approved.
Ruby's got her hand up.
Yeah, Ruby.
Can I make a recommendation that the vaccine clinics try to spread out into the new year? And I'll explain why. Because of the COVID cases that we've had starting in October, is that many people are recommended not to get the COVID vaccine until you're 2 to 3 months out, which means there are still people who need the COVID vaccine and the flu vaccines, but your clinics are done.
Good
And
point.
so you have to realize that COVID is an ongoing illness, that the mutations are ongoing. We're having new mutations all the time. And as you well know, this week, if you look at Johns Hopkins numbers, is that the death rate and the hospitalization rates has steadily gone up, more so than last year. What does that indicate? That may be indicating that we're not vaccinating enough,
Mhm.
which means that we need to have clinics way into the spring. I just got my COVID vaccine because I had COVID in October. So but I couldn't come to your clinic anymore. So therefore, there are many instances where people would benefit from having the vaccine even into spring. So I just
You know
want to
what?
throw that out to you.
Maybe a program could be worked on that where,
Yeah, I wonder if like even once a
Walk-in.
month having, well, so that's the other thing is that walk-in
walk in.
is something that's easy to do, right? But maybe we could try to have one more clinic to see if we get biters. It would just be a matter of like, again,
Advertising.
cause it ends up being like, what's 100 times, 115, right? So like,
Oh,
so it,
that's a lot of money.
it is, but if we had other groups that also didn't want to make the minimum order, maybe if we even got 30, then we would be okay, so.
We can investigate.
Thank you for that, Ruby. Thank you.
Yeah, it does make sense. I think according to CHP, they're out in the community and no one's going to get COVID shots. So we're like, do we try to purchase? I mean, we now have the flexibility to buy COVID vaccines, which 3 days ago we didn't have authorization for. So I think Jill, Jane, and I need to have a discussion about maybe purchasing 100 doses and maybe doing like a clinic and see what the registration numbers look like, and then that will dictate the demand ongoing. And I do agree with you, Ruby. Like we're so used to doing like a flu vaccination program like September to December. We kind of folded in COVID a little bit later because we had to get the standing orders. The vaccine wasn't ready, so we missed a couple clinics. Jane did work with the state, and they did come out, and the numbers were pretty healthy, right, Jane? With the state program that came out. Oh, yeah, definitely. Let's have a conversation about that.
Okay. Language support, what would you like us to do? Do you want us to notify you for signing? Is this for the,
Yeah,
everything interpreter?
so there's a language report, and then later on, so there's the HHAN, which I am still not clear, it's, there's the HHAN and the web EOC and the arbovirus coordinator. And so what I think that I need to do is send an email to all the different boards and just ask, like, who's the person for each one of these? And then we could add the language support
Okay.
onto that, and then that would give, so the plan is I've reached out to the HHAN person to see if I could get a list of who's existing, for each town. It's taken a while for her to get back to me, so I need to follow up. But, and then I think the focus of this group then is to get them trained on knowing what it's for and how to access it. And then we would have the backup information in case, like if they did either an emergency or if they did a test, that we could reach out to that person and be like, hey, have you been able to work this around? Do you need any assistance?
Okay.
Because we want to be ready if there's ever a need.
New business. Level funded town budgets. Do we need any discussion on that?
No, I'd just like to ask that each individual board of health just let their town government know it's been level funded, and to please put that into the same amount into the budget that's been primarily public health nursing. We do have contracts that are revolving funds. So Mount Washington, it's like whatever work we do or the fees that are collected, those come back to us. Same thing with Sandusfield, for the inspecting services. So that's not something that's budgeted. Same thing with Sheffield. It's work-based, but there's, but whatever we pay for like our public health nursing or for Sandusfield and Mount Washington, the agent services, that's just gonna be the same as it was last year.
So the VNA money, I mean, what we've got in our budget is what that old amount was, and that's
Level funded.
low.
Yep.
PHE budget allowable expenses.
So this was, the allowable expenses, for, public health excellence. It really is around programming. And so we're probably gonna have a surplus, right? So we've talked about possibly purchasing some COVID vaccine as, so that's about $10,000, right? If we were to purchase one minimum order, that's $10,000. And so I just really wanted to reach out to the group about other expenses that are allowed, that I think that would benefit this group. We can't do car seats because it's not a minimum standard. But we can do, if like your board needs like, software or hardware or computers or thermometer, like your thermometers or, you know, there's any equipment to do your job, pool test kits. That might be something. And so I think that maybe with that email I send out asking for information is, I think, like really looking at each town to see what types of things that they could use in their, as far as equipment in your Board of Health offices that would help make it so that you can meet standards. That's an allowable expense.
Okay.
Where are we with the permitting software?
So, Jason?
I can speak to that for a quick second. Sandusfield, I've finally gotten, full circle to narrow down to get me Sandusfield's permanized, squared away, and done. Once I've gotten that squared away and done, it should be easier to get the rest of the systems in place. Sheffield being one, Mount Washington being the other. So it's kind of a one at a time instead of all three. They can't put all three
So
towns
is that
effectively together. Sorry.
where is that expense coming from?
Public health excellence.
Yes.
Yeah.
That's what I thought, clarify.
Well, and so Mount Washington's already said, sure. And it's gonna be even though it's a small town, it's very far away, right?
So that's for the setup and then they cover the annual,
So that's for the setup and the
Software
first
and-
year,
the
Yeah.
first, year.
and then they would budget in the next fiscal year. And Sheffield, we haven't gotten a really hard answer, so it was Sandusfield first, Mount Washington next, and then we'll have the conversation with what the barriers are in Sheffield
Right.
and whether or not it's something that you guys really wanna do, or as a board.
And I think from a PHE perspective, the majority of the towns are on online permitting. Lee, Lennox, Stockbridge, Otis, Monterey.
Great
San-
Barrington,
Great Barrington, Sandusfield's about to, Mount Washington's about to. It's only a couple smaller towns. And so one of the things that, you know, we're trying to offer is we're trying to get towns to have their own standalone permitized, not to be under this massive umbrella going through another agencies, because we, you know, Tri-Town was one of the first boards of health to get on the online permitting. And so like we have unique SOPs and processes that we do that maybe Otis or Monterey or Sheffield ours may not want to do. So it's really important to be protective of autonomy to make sure that whatever Sheffield wants or Sandusfield or even, because I think New Marlboro's on the Alliance one, but you know, we have resources to get them on their own. And then you can be able to, you know, edit it for future use, whatever. So we're trying to get towns to be on their own standalone permanized system, so you're not going through a third party to make changes. Because and Jay, if I'm not mistaken, I think with the Alliance one, like everyone's under that umbrella. So if one town wants to make a change, it's too difficult to make.
well, it's more like if the town has a unique process, so it's like Sheffield, it's unique.
What an individualized one.
Yeah, and so there were some barriers that we ran up against, and, so yes, like, different towns have different things, and and, you know, sometimes, for some towns, it's fine to be, you know, kind of beholden to that. For other towns that have unique processes, they've been, that was one of the barriers to getting online permitting.
And we're committed to annually those costs, right? We have a budget to get new towns up and running. And so we're gonna, in perpetuity, as long as that funding keeps coming, there's a line item for online permitting that, you know, so if New Marlboro and others aren't ready in FY 24, but they'll be ready in FY 25, have those conversations with Jane and myself. So when I start to craft the FY 25 budget, we have that line item set for you.
Good. Okay, next line item, HHAN and the Aurora virus coordinator for each town.
I'm gonna send an email out to each town. And so like I'm going to New Marlboro's next week. I'd love to come to as many boards of health as possible, like just to,
Oh, sorry,
I just.
mistakes.
Well, but you know, I'd like to try to, just make the rounds now that I have time, courtesy of Jason, thank you, Jason. That is something that, I would love to do, just even to get priorities or just the figure out like from the board perspective, what it is that we could be doing to help the board.
Good one. Location, date, format for the 2024 meetings. I know in November we decided we thought we could go quarterly.
Yeah.
You need to set dates for that,
Well,
or do we still want to keep it with the second Friday down here? This is still always available to us, Rebecca?
Sure.
Thank you. It's a lovely place to come.
it is nice and it's centrally located, and I just wanted to check with you guys, to see if this is working for everybody.
Yes, 9 o'clock,
for
second
me.
Friday, the month of
Okay.
the quarter. So April will be the second.
Yeah,
So
You're gonna
that's
move to quarterly rather than monthly meetings then,
yes,
starting,
starting now. So our next meeting then,
That'd be April 12th.
April
Okay.
12th.
Thank you.
So what I'll do is I'll do a revise on my, so I've invited you, most of you, maybe not. I'll make sure everyone has an invitation that has quarterly, and I'll get rid of that monthly reminder. Sound good?
We did do monthly for many, many, many months.
yeah, and I wasn't here.
Well, and Jane, if I can just
But
add,
we
like,
can also,
the intermunicipal agreement talks no less than quarterly. We were meeting monthly for the first 2+ years because there's a lot to do. And I think now as the staff is settling in, we're sort of hopefully in maintenance mode. We got one more hire to figure out. There's some small things we got to work on. We want to be mindful and efficient with everyone's time. That doesn't mean we can't meet. If something comes up and there's like a grant opportunity or something, we still have the power and authority to work with the collaborative and set another meeting. So we should, you know, the framework should be quarterly, but if something time sensitive comes up, we will reach out. We do the same thing with the Tri-Town. Tri-Town meets quarterly, but during the pandemic, we met monthly and, you know, all this other stuff. And it seems like we're meeting monthly on the UDF stuff. So we all have the flexibility to set a meeting whenever we feel like we need to set a meeting.
Would you prefer to meet monthly?
No, I mean, obviously I haven't made it monthly, so I think quarterly. I think I'll need to have some maybe conversations with you and ask some questions at
to get
some
up to
point, if
speed.
that's okay, but yeah, I can get up to speed.
That's a good sign. Somebody who knows they need to learn. That's good.
Yeah. Well, and that kind of brings us into the next thing,
Train account.
the train account. So you do have, a fact sheet in your, on the last page. And, you know, I'm not gonna read it. That's my gift to you. That's my quarterly gift to you.
Okay.
But what this basically is it's a way to, for the state to keep track of like who's taken what.
Okay.
And so, you know, certainly as collaborative staff, so like, you know, Jill, Jason, myself, we have a higher standard that we have to meet. And the state also is pushing for minimum standards for all boards of health. So like Board of Health members, like in Sheffield that want to do housing inspections, it's like, okay, you can do housing inspections if you want, but these are the things that you have to have before you do housing inspection. You have to take the Mass Fit course, you have to take some basic courses. And the way that they're gonna kind of track it is this train account.
Okay.
And so far, they have set up the public health excellence staff with these train accounts, and I've gone through and started compiling all of the trainings that I've taken that will eventually be uploaded onto this.
Is it clear as a Board of Health member, when I set up an account, what I have to take, what is recommended for a Board of Health person?
At this time, no. I don't know what that's gonna look like, and I think, I go to the monthly meetings and it's explained to us, so I think that there's gonna be some education that we have. The Alliance also is our training hub, and so I would anticipate that there would be some assistance, like,
That 100 course.
so we're all gonna kind of work together.
Muddle a little.
And I think, like, not to call myself, like, based here is the PEG funded staff.
Right.
And in fact, the next tier is like inspectors or agents. And so like we did the food training the other day, Otis, Heather was there, Stephen went to that. All the Tri-Town guys went to that, and that is actually, Jordan went to that. And so my role in that was just kind of like being like, hey, guys, this meets the minimum standard. You have to have ServSafe and you have to have another training. This is the minimum. Is there any way you can make it? And actually Stephen was sick that day and called in. But now he can check that box. Great Barrington can check that box off that he's doing food inspections and he meets the minimum standards. Eventually, either through us or through the training hub, we will get the list of everybody to them and have everyone get set up, train account. There's gonna be early adopters and there's gonna be late adopters, and that's fine because it's a lot of people, right?
Mm.
And there's probably some that will never do it. But I'm hoping that it will be clear to, like, if you identify yourself as a Board of Health member that doesn't do any training, I'm hoping that it pre-populates with the things that you'd be expected to do.
Right. So would I.
Yeah, so
So-
for example, Jane, because we're still trying to learn all these performance standards things, which we feel it's going to go into state law at some point, which actually is a good thing, long term. But, each town is kind of set differently, right? There's small towns that may have a Board of Health member that does inspections, for example, that don't really have an agent. So the long-term expectations, it's something, towns want to start thinking about. So if you got a Board of Health member that does septic or perks or once in a while to do housing, at some point, you're gonna have to meet those standards in order to do that kind of work. Some board members don't do anything. Like I invite my board members out, but we handle all the operational pieces at Tri-Town. We do all the inspections, the Board of Health handles the appeal. So while each town's different, it's really important to long-term, because that's what we've been pushing for at least 25 years. I've been doing this, is meeting some type of standard, because in the past, we can't just have someone go out there with zero housing experience condemning properties. And there was never a standard before or a minimal training. The stuff that we do is really, really important to know and be knowledgeable of the laws. So, and that's sort of like where the benefit comes with PHE, with shared agents that meet all the standards and can help towns get to that point. But there are still some small towns out there that have health agents that are doing X, Y, and Z. And hopefully we can encourage those people to get into the training hub process, to get formal training and kind of move that thing along as time progresses.
And like, for instance, you'll see in the upcoming training, like, like the Mass Fit food class. Basically what happens is that is designed to be a multiple day course. And, you know, with the co-requisites, which are classes, online classes that you have to take at the same time as taking the Mass Fit, it's a heavy lift, right? I would assume that most board members don't have the need to take that class or would want it. But, that would lead somebody like Jordan to, be able, or Jason to be able to get FDA certified. Not the actual class necessarily, but that meets the standards that the state is setting for like a higher bar. So, yeah. I know I'm not articulating it well, but, we'll be well aware and work with you guys.
Well, and I blame the state for that. We need to get more information, but one thing, Jane, that would be helpful. I still struggle with not so much my board members, but understanding like the ICS training, like the NIM 700, the ICS 100 and 200. And I know Laura has sent me links to the ICS training, but those websites are completely disastrous to understand what trainings we need. So if we want to get our boards of health to get the, you know, the emergency training that they should have, it'd be helpful to have an easy link and an easy process for Board of Health members to work towards. Cause I went to those sites and they're like, I can't figure out those sites.
No, they're actually really are awful. And, the ICS 100, you know, NEMA, which I go to a meeting once a month that has NEMA there. You know, maybe we could talk about NEMA, about getting that easier because, and I'm not Googling the internet, like,
Oh,
not
yes.
Googling the wide World Wide Web, but for Board of Health positions, it tells you exactly like what the minimum amount of things, and I think that might be a really good thing for us to start is like trying to get an easy access where people aren't having to spend a lot of time or get frustrated, to get our board members, especially the emergency piece, which it is important, like, you know, if one of our towns had a major emergency, the Board of Health would have a role. And the agents, we might be doing other things as well. Like it would be really nice to have a board to understand their role and be doing that role so that, the agent could be doing what they need to do and the emergency management could be doing where they need to do. And what those trainings really are is a framework of figuring out where, for Board of Health, where you fit into that, for us all, where we fit in.
So you, at this time, you don't have a list of what you consider essential for board members?
I do, and you know what, at the very end, I can maybe, see if, I don't know, Rebecca, if I could send it to you and you could print it out. I can get that for you guys today. It should probably could have been in the packet or I could email it.
Ruby had a question. You're on mute, Ruby.
For example, for all physicians in Massachusetts, we need to do a certain standard of training, even though it may not apply to us. For example, the opioid crisis, we had to do training and mitigation. Is there training requirements for all health board members, even if we're not in the health field, just so that we have an overview of what public health is and how important it is, our job in understanding the work that is being done? Because I know that most of us have had some health training, but we don't really have public health training up to par to what is going on right now. And I was very pleased to see that the training program is put out by the state, but there is no recommendations for board members.
Mike?
Yeah.
So there is, I'm on there right now. It says orientation to public health within 3 months of hire. And that really is a great class. I don't think it takes a tremendous amount of time to do that. I mean, foundation course within 1 year.
Required courses, for example, how does vaccines work? And how does it, how do you study that? How do you understand the effectiveness and the shortfalls that it has? How do you do public communication? How do you handle when there's a discourse? These are very important abilities that a board member needs to have, but we don't have any training or support.
Okay, so actually, Ruby, you sat through I think it was 2 months ago when Cheryl and I did something for Great Barrington, and that's one tiny piece of the program that's now scheduled to be at the Delaney House on March 30th. We're going to be, and that is something that you should really all make sure that all of your board members get to, because it aside from the fact it's two spectacular meals that day as part of it, but we have a great program, and it's going to cover everything from open meeting and ethics and uh, uh, public records, duties and responsibilities and powers of the boards of health, PFAS, how to go after a water company. If, say, hypothetically, there was a bad water company in some area, how to tackle everything from that. We're going to actually be working using Housatonic as a teaching tool, along with Plymouth's Pilgrim Station, where we've just discovered that there are 62 casks within 300 feet of a road, and each cask has up to 1/2 of the cesium as was released in Chernobyl. And
Wow.
they can be hit with a rocket propelled grenade, or
Wow.
even you can throw a grenade that far, actually. That's how close they are to the road. And if those were ruptured, there'd be nuclear devastation on the Cape and Islands and Plymouth and Bristol counties. And yeah, and Board of Health happens to be the only one that's even looking at it right now. And we've already stopped them from dumping the water, the 1.1 million gallons of contaminated radioactive water into the bay. So we're going to be using Housatonic and Plymouth as our teaching tools. We're going to talk about conduct of board meetings, how to deal with difficult people who show up at board meetings across the state. There's a whole panel of them. They sign up. It's almost like calling a taxi now. There's a movement afoot to infiltrate board of health with disinformation that was originally aimed at school boards, but now I'm told that that they've found that the school boards don't have the power that boards of health have, so now they're going to try to infiltrate boards of health with disinformation campaigns. We're going to be talking about all of that, and some of those are very difficult topics. Some of them might make some people who are present angry at us and at each other, but it's something we need to rip some band-aids off. So this is going to be an especially moving and at times difficult program, but we're going to be doing it at the Delaney on the 30th. We're doing it in Taunton, which I think is way too far for you guys, and the closest one other than that is in Marlborough, and we're working on scheduling that one right now. It'll be sometime around then. It'll be in the spring.
Yeah, but what about?
Where's Delaney House?
Oh, what?
It's in Holyoke. It's the Delaney is the same as the log cabin. You met some people know it as the log cabin. Same company.
Do they have pie there? Is that the pie place?
I don't know. They have a spectacular kitchen though, and we really do. For those who haven't been to any of our meetings there, we take advantage of it. Cheryl and I are foodies, so you know, last time if you were there, you got steak for lunch. Yeah, so
Mike, if I could just add a couple things, I'm putting my equity hat on.
Mhm.
You know, I think MAHB does a fantastic Board of Health orientation program. And you get value when you're in person because there's a lot of back and forth questions and answers.
Mhm.
But, we still have a lot of retired board members. Some are still working, juggling. I mean, my board is loaded with physicians and nurses, and they just can't commit to driving out there for a day like that. Is there any conversation about hybrid access, maybe a foundational Board of Health orientation training that can be like a webinar series? Like, for example, we just we just updated our tobacco retailer certification program to a more equitable, formal training that's designed for boards of health, which I'm gonna be sending out soon, by the way, everyone. It's just, you know, there, you may not get the value of the back and forth, but the foundational piece, you know, if Tom and some of the Monterey boards, you know, they're really busy, just can't make it out there. We want to make sure that we have access to these trainings, like in perpetuity, you know, that we, you know, like there's a catalog where we can get access to these kind of trainings, because we have the technology, you know, we have the IT infrastructure now to kind of make these like different types of trainings. I'm just throwing that out there. I know it's hard.
Yeah, we did during COVID, because we had no choice. We did some hybrid, not hybrid, they were remote, fully remote Zoom trainings, and it worked actually the doing it hybrid works very well, because you can get some input, and we opened it up to people to ask questions and answers that were in attendance at that. So those were available. There have been enough changes, significant changes in some of the public health law that's now outdated. So I'd say, well, we could always just send you the link for that, but it doesn't really give the right information in some areas anymore. The answer is that's why we do it on Saturdays, for one thing. And I know that some people have to work on Saturdays, and that those people have fallen through the cracks. From an equity standpoint, I think you're right. We will be potentially offering smaller group and maybe more concentrated stuff. I think that at some point, I think Cheryl and I will be back out there in Great Barrington, and what we may do, and you tell me, because you're each of the boards of health here, that this is the right place to ask this question. If we did set up something in the room that you're sitting in right now, could we get all of your board members there on either on an evening or on a Saturday type of a program?
I would hope so.
Mike, we wouldn't have to post that as open meeting law for a
No,
training.
no. And actually there's an interesting crack in the thing, and that under open meeting law, if you're attending, everybody can attend seminars, and usually you see people from the same boards of health sitting at the same table together, unless there's one that's pissed everybody off and they've sent her or him to a different table, which I've seen several times. But unless they're exiled to Siberia, usually the boards like to sit together, and we encourage them not to talk about their own board business, and that can be difficult, because we're talking directly about Board of Health stuff, and the temptation is just huge. And I've attended these as not an MAHB staffer, but as a board member. And you just want to turn to the person next to you and say, see, that's what we need to do with such and such a thing. We need to be going after this restaurant because 6 times they've been before our board, and now you've just committed an open meeting violation. But if you
Maybe
can
we
see,
could give everyone like a folder to write down all of their thoughts and then close it and then share it at their next meeting or
well,
something.
I mean, we encourage people to do that, because you will, regardless of how seasoned you are, you're going to hear things that are going to trigger something in your mind that maybe no one else at your table is thinking of, about something that, when we're doing these presentations. But I think that, we have yet to see anybody rate anything poor. When we do ask everybody to fill out surveys, and either they're being incredibly polite or I don't know, because I don't think that we see anything but excellent straight down the line. And the comments that go with it are even more important, because it's easy to check off, yes, this is wonderful, and walk out the door. But to check off yes and say, this is what I liked that you did. And Cheryl and I, when we start, like we're doing this right now, we actually pull out the old rating sheets to make sure that we're picking up on strengths as well as weaknesses, because it's all important. So
Mike, so Jane, could we maybe poll Board of Health members to see if that'd be something they'd be interested, maybe on like a Saturday or something? I would love to see like a very large participation of Board of Health members that can make this kind of class, if possible. But I don't,
Yeah.
if the demand is low, I don't want to ask Mike or Cheryl to come out on a Saturday for 3 people either.
No, we can definitely do that. And then the other thing I wanted to say back to the training thing is there are some really good trainings also that, similar to what Ruby had talked about, on the LPHI, program that's sunsetting at the end of March. And so it doesn't make sense, I think, to like get people on there and taking those modules, because they're not gonna automatically transfer to the new training system. So maybe starting in April, once the training system goes live, maybe that would be a good time, maybe through talking at the MAHB, when we have all the Board of Health members there, maybe one of the things we could do is show people what the train system is and how to sign up and what the minimum requirements are for the board. I think that would be the most efficient way of getting people who are interested.
And Mike, that March training is that, if that's official, can you just maybe resend that to us? And by the way, Delaney House Mother's Day brunch is 5 stars.
I will.
Yeah, and I think Becca wants to say something as well.
And I am
So-
sending out a save the date, and I'm trying to get it out today.
Okay.
And if anybody received an email from me yesterday, I don't know whether anyone in this group did, because we have a group of dead emails. And all I did was send to that list of dead emails, if you're getting this, please contact me. And, maybe 10% of the people that get it will contact me, but we're really working on our list. It's very hard. We have the hardest group because we have about 1,000 Board of Health members across the state, and there's always a resignation, a death, a new election, or whatever. So the turnover is daily, and our lists are just impossible to keep. So if you get anything from us, let us know if we're asking for input. But I am writing down train right now, Jane, on my notes for the certificate program. We'll have a session there. We'll bring somebody in from DPH from that unit to come and talk about how the online training, because all of the online training is it's all about to change radically. And it'll be right then, because I think March 30th, and then I think April 1st is when they're saying that everything will be going live. So that would
be great. That would be great. And I think Rebecca has something she wants to add.
Well, I guess I have a couple questions, but my original thought is that, paying for training for local Board of Health members and agents might be an allowable expense.
Yes.
It is. Oh, it is definitely. We've got a ruling from DPH on that.
So equipment and inspection utensils are really wonderful, but it sounds like that's the real deficit among South County Board of Health members, agents, is just meeting those minimum requirements. And if the local public health institute is sunsetting, as you said, does that mean it's going to be replaced with something equal in kind, free on your own time modules?
Yeah.
Okay. Fabulous.
And a lot of those will just be migrated over, that the ones that don't need to be updated will be migrated over. But I think to your point of training, they up the amount of mileage per capita and can pay for training. So like, that's another thing I'll put in the email, follow-up email, is like, are there trainings that your Board of Health could use assistance?
Right, and you've brought this point up before, that even if the training is paid for, the Board of Health members aren't necessarily paid for their time to go. Is that something that could also be paid for?
I don't know. That's a good question.
I've never heard of that.
So if there's equipment, like Rebecca, you need flashlights, temperature thermometers. Everyone get Jane a list of equipment that you may need. That's an allowable expense. Second, everyone wants to go to the MHAB training. I don't know if there's a cost associated. Sign up. I'll pay the bill. With respect to paying Board of Health members, that makes it difficult for us, because administratively, like, unless someone's going to send me a bill, that makes it really difficult, because
You probably have to do W-4s and everything else, Jim, too. There's a lot on the back end of paying.
Yeah, I can't just be cutting. I can't have Town and Lead just be cutting checks to a Board of Health member to go to a training either. So
I hear you. It probably would be a big hurdle, but I think that we should continue this conversation, because you brought this up multiple times, it was a barrier for especially Board of Health members to taking these trainings, is because they're not necessarily compensated the way I'm paid to go to a training. It's during my work hours. It makes it easier for me to go, so.
I wonder, rather than talking about it as a compensation wage-wise, that there's just a stipend associated with it, a flat amount of some.
Well, that's the
Well,
same, but that's the same thing,
officials, they
Cal.
are-
Okay,
Also, though, you know, thinking now from the ethics end, there are ethics rules in Massachusetts against being
$50.
paid two different
Mm.
two different functions within a government. And you may have some of your board members that are being paid by their town for doing some job that they actually really do for the daytime that might be on a board. And then if you give them a stipend on top of that, now they're receiving compensation from two separate elected functions or appointed functions. So that could come in. There's a lot behind that question, and I think that
Yeah.
you'll find that while it might be nice, it might be so burdensome that it might just not work.
But maybe something I could do maybe is just try to map it out and see what the barriers would be and at least look at it maybe.
All right, well, why don't we put it down for a future?
If we do this, program here in this room, can it be like May or June that we do it? Because at least our town finance committee is pretty busy in March.
Oh, for,
Yeah, going into budget season.
and on these small towns, a lot of times the same people are on the finance committee, Board of Health. We had a joint meeting with the Board of Health, Board of Health Planning and, Select Board, because there were a lot of the same people are on all of them.
Well, you guys have your school committee chair as your board of selectmen, or your select board chair too in Great Barrington. Because he attended, when we came out, he attended our meeting under, I think, I'm hoping, under two different hats at the same time.
All right. Moving on, upcoming trainings, I think it's just there for us to read. I don't think there's anything to talk about, just to let you know that they're there and to keep us informed of anything that keeps continuing to come up. Member updates. Yes,
if you haven't already done so, or if you need more, you can order more COVID kits from the state. Even though you may have placed an order already, if you haven't hit your max of, I can't remember. 1,800, you can place another order, which I did last week, and they arrived within 3 or 4 days. So, and there are other things you can get, individual sharps containers and shields, no more masks apparently, and soap. They're pushing soap, but
wow, well, for hand washing.
yeah. So anyway, just if you need more, feel free to order more.
Nobody else order any more Sharps containers, because I ordered
Yeah,
literally thousands of them,
Oh.
not expecting that I would get all of what I ordered.
Okay.
So if anyone wants the individual, well, they're a little bit bigger than the standard individual
Great.
kind, but if anybody wants some, please take an entire box or 3.
Otis
Can I
might
get
need
some
some,
today?
right?
Yeah, the bigger ones.
Yeah,
it's like a big
I
We
think we
had,
have
we
one
had
left.
somebody put into the trash, just
Yeah,
like a
Yeah,
plastic
maybe we can
bag.
get the bars of soap to the restaurant so they can wash their hands when they're preparing food.
My mom ordered an
I don't know if it's
but-
bars or, I don't know what it is. I didn't order any.
Some of the other groups are looking at fentanyl and xylazine test strips also. I don't know whether or not you would have.
So actually, the BOC, but Berkshire opioid
Mhm.
OC. Actually, if you contact them, and I can send out that email link, they'll mail them right to you. And they're these little kits, and they have 2 Narcan. They've got
If
yeah,
anybody wants,
2
you
Narcan. It's got a fentanyl test strip, not the xylazine yet.
can open it up.
But any Board of Health can have those, and there's really it's really easy to get them out, so.
I've ordered 50 of them, and they didn't want to mail them. I ended up going and getting them from the Alliance, but they were happy to give me a box of 50, so it's out there and available.
I think I have a box of 20 in my office. If you'd like to have that, you can.
And
Yeah,
that's
I'll
the other,
take one back to the town.
and that's the
You
other
want
thing
one
is like,
No, I was.
you know, when we're thinking about our website, like, I wanted to throw out to you guys what you thought about, you know, like having, really looking at all the websites, maybe with our new access, with our new access community health worker, and looking to see if, like, do we want to have a link for how to get a, Narcan mailed to you, or, you know, all of the different things that are kind of available. Maybe this would be a good year to look at each town's websites and see what improvements could be made.
Or even if there is a website. The Board of Health Sheffield does not have a website for the Board of Health. Never mind.
The Narcan thing's very interestingly, I know that you guys are sort of in the Albany media market, so you might not know how bad the situation is in Lowell, Massachusetts for opioid overdose, but more than 50% of the opioid overdose Narcan administrations are by casual passers-by, people who see somebody, they happen to have it in their pocket, they carry it. And now the rate, because of such wide distribution of Narcan in Lowell, more than half of the rescues are by people who didn't know the person before they administered it, which is shocking.
It's
really.
interesting too, like at UMass, when I was a parent and went to the orientation, I raised my hand and I was like, do you have any harm reduction programs to
You
help?
would.
Yeah, and I'm like having Narcan in the dorms, and I mean, I was like a pariah, especially to my husband and my child who was sitting next to me, and they're like, now everyone's gonna think that Tyler's doing drugs. And I was like indignant, like, no, we should be asking this question. The answer was no, by the way, they didn't have anything at that time. So then when my son went to college, I sent him with essentials, right? Condoms and a Narcan kit, and he was again incensed that I thought that he was gonna do drugs. And I said, Tyler, if you're in the dorm and someone has an overdose and you know, if you have that, you're gonna feel a lot better knowing that you did everything you could. So when he came home for Thanksgiving, he actually said, can I have another Narcan kit? There was someone who was high risk and I gave them mine. And I feel like just getting that generation, getting it into their hands, and the parents are a barrier. Do you know what I mean? Society's a barrier, and even their own version of themselves can be a barrier, but like, there's a lot of work that could be done for that, and it's been very uncomfortable for my family, for me to be pushing Narcan.
I handed out 100 Narcan kits, I think it was at least, at the Sheffield Fair. And I had the same reaction. People, as they walked by, I said, can I give you a Narcan kit? And you have the opportunity to save a life. And the implication was that I was accusing them of drugs. And it took a little bit of conversation before I, was able to refine my script, and talk about it as being part of their first aid kit. I want to add to your first aid kit at home, and here's an element that's really important. Let me tell you about it. That went over very well.
I use Jewish guilt. I'm Jewish and I take advantage of it. And I say to people, how would you feel after you didn't take this from me and you needed it? Boom, give me 6,
Oh, God. All right, there's no citizens here to speak. We have the next meeting date squared away.
Excuse me.
Yes, Tom.
I have a question. It's sort of personal to Monterey. I'm on the Health Commission and also the Parks Commission. And we're looking into expanding some of the common congregating areas coverage with AEDs. And I'm pursuing this with our fire and rescue department. But I wanted to draw upon the knowledge base of the people at this meeting. If number one, you know of any standards that the county or the state might have in terms of how many AEDs or where AEDs should be placed. And for our own application of the AEDs, we are looking into exterior mounting, and there are cabinets that will provide ventilation and heat to satisfy the manufacturers of the AEDs requirements for storage. I was just wondering if anybody here has any insight into those questions.
Library.
The thing I do know is there was a grant several years ago and it got put in a lot of different places. And one of my husband's goals is to look to see if they're, if the, I don't know if it's the battery or the pads have expired. And so the hard part is it's just keeping it current.
Correct.
But I don't know, Tom, I'm happy to, kind of look at what those requirements are, and we could at least know what it would be, if that would be helpful.
Well,
Thank you.
thank you. I do have that information already. What I'm looking for are any specific recommendations that the state might have in terms of coverage.
Tom, I put my contact information into the chat just now, so if you want to just shoot me an email asking your question, I'll send it up the chain at DPH and see if I can get like some kind of an official something for you, at least a site for you to go to to see what they're what's there. So I'd be happy to help you to chase that answer down.
Thanks. That sounds promising. Okay.
I thought you said 12. No?
What did you say?
Oh, April 12th, yeah.
Yeah, April 12th. Anyone want to make a motion to adjourn then?
So moved.
Seconded, everybody in favor? Aye.
I-
That's it. Thank you, Mike, for sitting in and for everybody else
Okay.
on Zoom. I think
Always a
that's-
pleasure to see you all. Bye-bye.
Thank you. Bye. Thanks, Aaron.